Hi everybody, my name is Luke Vance. I'm going to be talking to you guys today about occupational therapy, specifically for a patient who would like to throw discus. A common question I get is, what is the difference between occupational therapy and physical therapy? Physical therapy is focused on movement and mobility, while occupational therapy, our main focus is to find a way to help a patient complete a task or occupation that they want to do. In this case, our patient is ambitious and it is up to us to find accommodations that will help them complete their goal. You're going to find many different types of athletes competing in Paralympics. Just a few types of impairments in the discus throwers. Impaired muscle power. The muscles in the limbs and trunk are completely or partially paralyzed. This could be caused from a spinal cord injury, polio, or spina bifida. There's also an impaired passive range of movement. Joints could be permanently reduced due to trauma, illness, or deficiency. Leg length difference, visual impairment, those are kind of self-explanatory. Intellectual impairment, which could have happened from limited intellectual functions or happened at birth, and also limb deficiency, total or partial absence of bones or joints from birth. Our main focus today is going to be impaired muscle power and limb deficiency. So before we start working with our patient, we need to have some type of plan. In this case, we're going to use a SOAP plan. The SOAP plan is used throughout the whole medical field. You're going to find nurses, doctors, physical therapists, occupational therapists. A whole bunch of people throughout the medical field are going to use it. SOAP stands for Subjective Objective Assessment Plan. The subjective part of the SOAP plan is observations that are verbally explained by a patient. So symptoms that they tell you, or basically why they're your patient. The O part of SOAP is objective observations that can be measured, seen, heard, or felt. It's also the vitals and the condition that the patient is in and how it affects moving forward. The A part of SOAP stands for assessment, diagnosis or condition that the patient has. It's also understanding the problem and interpreting it. The P part of SOAP plan is plan. So now that we have everything we need to know, we need to make a plan in order to fix the problem and fix our patient. So how you will address the patient's problems and goals. So now that we understand the SOAP plan, it's time for us to evaluate. We have our patient, and the subjective portion that our patient gives us is he has no control over anything below the lower abdomen, and he would like to compete in the Paralympics throwing discus. We find the objective, the facts. His age is 20. He suffers an injury from a car accident in his L2. As you can see, the L2 lies at the hips, so he has no feeling from his hips down, and he was a former track and field athlete. He has told us that he has not practiced post-injury and does not have the accommodations to do so, and he's also unsure of his form while accommodating the injury. So our plan moving forward, when knowing the subjective, objective, and the assessment, we have to make accommodations for him to throw. So we will meet 3 times a week and first focus on his form while he's at these meetings. So we have a plan for 4 weeks, meeting 3 times a week. As you can see, patient will be able to throw discus using accommodations while using proper form 100% of the time. Now, he also needs to start doing things on his own while we teach him form. So the patient will also be giving workouts at home in order to build strength and coordination. Accommodations for these workouts will be placed at patients' homes. He will be given workouts to do at home 3 times a week on 9 meeting days in order to build strength and coordination. So 3 days out of the week, we're meeting together. 3 days out of the week, he's doing workouts at home on his own, and there's 1 rest day. Now that we have our plan together, we need to consider our accommodations. When considering our accommodations, we need to look at what class our patient's going to be sitting in, the throws chair or the day chair, so what kind of chair they want to sit in, and the chair regulations. F31 through 34 and the seated throws classes are for people who have coordination impairments. People who lie within F35 and F34, they have the choice whether they want to sit or stand. In F51 through F57, the people who lie within those classes have limb deficiencies, leg length difference, impaired power, or range of motion. at 42, 43, 44 through 57, people who lie within those classes have the choice to sit or stand as well. Our patient's going to lie through F51 through F57 and is not going to have the choice to sit or stand because they're unable to. So impaired power and limb deficiency takes an effect there. Now, when sitting, we have to choose what chair we're going to use. A throws chair is a chair given to the patient. So it is provided for them. They do not sit in their chair, whether it's a wheelchair or a power chair. A day's chair is just the chair that they're usually sitting in. So if they want to use their wheelchair, they can do that. Now, either way, if they use a throw chair or a day chair, they have to follow these regulations. The max height cannot be any higher than 75 centimeters. Side length's 30 centimeters long, as you can see. I'm not going to read the whole thing. It's very specific. If you want to take the time and pause the video, you can read it yourself. But the basics are, they can't be any higher than 75 centimeters. You can have a pole that's not able to bend, a backrest, and you must be strapped in. So the throws chair. There are several pros and several cons to both chairs, but this is the breakdown of it. Throws chair is usually higher than the day's chair. It meets the 75 centimeter mark. You're also able to use a bar when you throw to pull your body forward, so you get more momentum, more body movement and rotation as listed. It's also easier for officials to secure them in the circle because they're more familiar with the throw chair. So if a patient were to come in their wheelchair, then an official wouldn't be as familiar. It's not as timely. A whole lot easier. Some cons: it's difficult to transfer some athletes if they're overweight or if they need a lot of help from their wheelchair or whatever they use day to day. Sometimes it can be difficult transferring them to the throws chair, especially if it's a lot higher up, 75 centimeters like we talked earlier. It may take some time for the athlete to become comfortable. They're going to have to provide themselves with a throws chair and practice in it in order to get used to it. Throws chair is also used by multiple athletes, so they will have to adjust the throws chair. If they just have one, unless somebody brings their own throws chair, which is highly unlikely, but it does happen sometimes, they have difficulty transporting the throws chair if they do own their own one to meets and practices. So the day chair, just some pros. Starting off, we have a seating position with the backrest. It creates stability for the body when throwing. Also, it's not listed here, but you may be more comfortable in your own chair. It eliminates the need to transfer onto the throws chair, so it saves time, and competitors don't have to bring their own equipment. Enables anybody in their wheelchair to throw and compete in the seated throws. Going to the cons, the lower height, sitting in the wheelchair where it's lower than the throws chair, does have an effect on how far you're going to throw, but we are able to elevate the chair to 75 centimeters if requested. Adapting the chair and giving a throwing bar, it could be challenging. You may have to weld it on there or pay extra money for that. They are hard to find. A day chair, it's hard to move. There's not much mobility because of the backrest and because the arm rests, and it also may not meet the rules for the league. Now that we've talked about the accommodations and we're able to use them, it is now time to focus on form and strength. Now we're meeting with our patient 3 times a week for 4 weeks, and the goal for the end of the 4 weeks is to have proper form 100% of the time. Now form takes strength and coordination, so the workouts I'm going to be giving our patient are going to be explained. Now we will use bands instead of free weights. No free weights because we want to keep our patient as independent as possible. We don't want them to have a spotter and have to depend on somebody else to be there. Bands are easy to use, very versatile, and he's going to be doing 3 different workouts a week. One for core, one for push muscles, and another for pull muscles. So the first 3 exercises on core day, he's going to have seated back extension rows, 3 by 10. Here you can see a woman performing back extensions. You can see she's leaning forward and pulling back with her lower back and her abdominal muscles. The next workout our patient's going to be able to do for core are straight arm twists, 3 sets of 10 each side. Here you see a personal trainer working with his patient using straight arm twists. So you see he's using the band, which is wrapped around a bar, a stable bar, and he is twisting to the left, and a patient should do 3 sets of 10 to the left, 3 sets of 10 to the right. Now you're going to show him how to do it at different angles. Now you can come from down to up. This is called incline, and we're working different muscles of the obliques and the core. The last core exercise that we're going to need to do are seated crunches, 3 sets of 15. This is also going to be used with the band. Here we see the trainer working with his patient again. He has hooked the band above his head to another stable bar, and you can see he's holding it next to his head, doing crunches, working his abdomen, working his rectus abdominis. All 3 of these workouts should hit most of the core: the lower back, the abdominis, and the obliques. Now working on push exercises, we're going to work on single arm flies, 3 sets of 10 each arm. This works the chest and the triceps. Here we can see this man performing the single arm flies. It's a great way to isolate the chest. It doesn't hit so much on the triceps, but it's definitely a great chest workout. Next workout for the push exercises on our list is the underhand tricep extension, 3 sets of 10 reps each arm. Here you can see somebody getting ready to do our underhand tricep extension. You can see he's keeping his elbow straight. Back is not much movement in the shoulder. And it's a great way to work out your triceps and hit the medial head as well as the short head. For our final push exercise, we have single arm tricep extension, 3 sets of 10 each arm, just like before. Here we see a man performing the single arm tricep extension. He's also having very little shoulder movement, keeping his elbow stable and using proper technique. Our final set of exercises are our pull exercises, so our back and our biceps. First, we're going to do our pull downs, 3 sets of 15 reps. Here we have a woman who is not in a wheelchair, but she is still seated. You can still do this in a wheelchair. She is performing the pull down, which is working her back and her lats. Next up on the list for our pull exercises, we have our seated bicep curls, 3 sets of 10 each arm. Here we have a woman performing the seated bicep curls. You see, just like with the triceps, she's keeping her shoulders still, her elbows in the same place, or she's very stable and having a lot of contraction. We can set up stable bars throughout the house with any of these exercises in order to keep the bands the same, they're stable, and allow the patient to have a good workout. The last exercise we're going to have for our pull exercises are seated rows, 3 sets of 10. Here we can see the seated banded row. You do not need to be on the ground. You can be in your chair, stable with the brakes on. Very good workout, hitting the rhomboids, the traps, all you need. Now that we've made our accommodations, we understand the regulations, we've got our strength and coordination workouts 3 days a week, and we're meeting for form 3 days a week. It's time to take action and get our patient moving forward to accomplishing his goal to compete in the Paralympics throwing discus. Thank you guys for listening and taking the time to watch this video. I really appreciate it. Have a good day.